Tim Klein video on CPR. Alright, welcome back guys. Today what we're going to be talking about is managing an unconscious patient. We're going to be looking at rate and ratio. We're going to be looking at a video clip related to CPR from the American Heart Association. We're also going to be looking at the difference between oxygenated blood and deoxygenated blood and where it goes through the body. And then we're going to follow it up with a hands-only CPR type technique, and we're going to see how effective that is on the body. So what I'm going to do is start with managing the unconscious patient. And the first thing that you would do in managing an unconscious patient, a review from yesterday, is what?
Shake and shout.
So you got to shake and shout. Most of you know that. We reviewed it heavily yesterday. And you guys know it's not just shaking the person, it's also shouting into the person. If you don't do that, what might happen to you? Yeah, you could get hit. Excellent. So what's the second thing after shaking and shouting? So it kind of goes along with the shake and shout, pause for a response and wait for them to respond to your shake and shout. Then essentially the next step is what?
Call 911.
Call for 911. Now, when's a time that you would leave the patient and call 911? Leave the patient who's dying. When what? When no one is around. So unless you have what in your hands? So unless you got it, if you have a child or an infant, then it is appropriate to do 5 cycles of CPR or 2 minutes of CPR. So, all right. Then you're going to continue on with your assessment. Then, as far as managing the unconscious patient, as far as the care, what's the first step that you would take? First thing would be airway. Followed by what?
Breathing.
Breathing. Followed by what?
Circulation.
So, and you can see it right there. Once again, just a quick review for you guys. You have the airway, and you can see how he's doing a head tilt chin lift. You look, listen, and feel for breathing. You can see that in that video or that clip right there, and then the compressions. So, and with these compressions, you can see how he's well over the patient, like so. His arms are locked off, and his arms right here, his hands are interlocked, and he's using the nipple line as a landmark. So, what I want to focus on today, though, is this. Number 1, rate, and then number 2, ratio. So with rate, you guys need to understand, as far as the compressions go, you go at a rate of 100 times a minute. So a lot of people get confused between rate and rhythm and ratio. With this, once again, it's 100 times a minute, but how many compressions do you give? 30. So you give 30 compressions, but you go at a rate of 100 times a minute. If you go at a rate of 100 times a minute, it takes a little bit of rhythm. So with the rhythm aspect, I like to think of it as dancing. How many of you have, say, gone to prom or gone to some type of dance, and you see someone in the back corner, they think they know how to dance, however they think they know how to dance, and you're looking at them and they have no rhythm. They're dancing, they're doing something, but yeah, I see a lot of smiles out there. They have no rhythm as they're going. So they're doing all sorts of weird things on the dance floor. You need to think of rate kind of as someone dancing. You guys know you do 100 or 30 compressions, but you know that you need to go at a rate of 100 times a minute. So another example is if you were to hop in a car right now and drive 60 miles per hour, that doesn't mean you would have driven 60 miles. It means what?
You were going 60 miles an hour?
You're going 60 miles per hour. You're going a rate of 60 miles per hour. Meaning if you drive for an hour, you will have covered 60 miles. Completely different from going 60 miles. So you're going at a rate of 60 miles per hour. You may only go 60 miles per hour for a second, but you're going at a rate of 60 miles per hour. So soon we're going to practice compressions. I'm going to actually have some music going on for you guys. And the beat, or the rate, is at 100 times a minute. So I'm going to play that for you guys soon. But remember, as you guys are doing chest compressions, it's at a rate of 100 times per minute. So as you're doing the compression, as you're over the patient doing the compression, make sure you're pushing down with the beat at 100 times a minute. You're still only going to do 30 compressions though. Be aware of that. So rate is completely different from the next thing, which is ratio. And what's the ratio for adult CPR? One rescuer. It is what?
30 to 2.
30 to 2. So, and you can see how she just gave 2 breaths and she checked for a pulse, and now she's going to deliver 30 chest compressions. So we'll just stop it right there. With this, once again, completely different from the rate. Ratio is the 2 breaths, the 30 compressions. So once again, the 2 breaths, 30 compressions, whereas the rate is what? The rate is what again?
100 a minute.
100 times a minute. So that's what we're going to be practicing now with mannequin, and then we will go from there. So.